Your Excellency, former President Pelveneliev, Your Excellency, former Prime Minister Brown, dear colleagues and friends, as we recover and rebuild from the COVID-19 pandemic, we must kickstart progress towards the health-related targets in the Sustainable Development Goals and WHO's triple billion targets. Even before the pandemic, we were well off track for the SDGs. Now we're even further behind. But the pandemic has only shown us why the SDGs are so important and why we must pursue them with even more innovation, collaboration, and determination. WHO is proposing 5 priorities on which we're urging all countries to focus. We call them the 5 Ps: promoting, providing, protecting, powering, and performing for health. Let me explain each one briefly. The first priority is promoting health and preventing disease by addressing its root causes. We must recognize that health does not begin in hospitals or clinics, but in homes, streets, schools, workplaces, markets, and communities. Much of the work that ministries of health do is dealing with the consequences of unhealthy diets, unsafe water and sanitation, polluted environments, dangerous roads and workplaces, and the aggressive marketing of products that harm health. WHO is therefore calling on all countries to make a paradigm shift to address the drivers of disease with a whole of government, whole of society approach. The second priority is providing health by radically reorienting health systems towards primary health care at the foundation of universal health coverage. More than 90% of essential health services can be delivered through primary health care, including routine vaccination, prevention and treatment for communicable and non-communicable diseases, and services for sexual and reproductive health. Strong primary health care can avoid or delay the need for more costly secondary and tertiary care. This kind of primary health care depends on a health workforce with decent pay and decent working conditions. At the eyes and ears of the health system, primary health care also plays a vital role in detecting outbreaks at their earliest stage. Which leads me to the third priority, protecting health, by strengthening preparedness, response, and resilience at the local, national, regional, and global level. There have been multiple reviews of the global response to COVID-19, with more than 300 recommendations. Based on an analysis of those recommendations, WHO has proposed a cohesive framework for a stronger architecture for health emergency preparedness and response, with stronger governance, stronger financing, stronger systems and tools, and a stronger WHO at its center. Some of that architecture is already being built, including the International Accord on Pandemic Prevention, Preparedness and Response, the Pandemic Fund, the Hub for Pandemic and Epidemic Intelligence in Berlin, and the mRNA Vaccine Technology Transfer Hub in South Africa. The fourth and fifth priorities are enablers of the first three. The fourth is powering health by harnessing science, research, innovation, data, digital technologies, and partnership. And the fifth is performing for health by building a stronger, more agile WHO that's better placed to support countries to achieve their national priorities. Excellencies, dear colleagues and friends, this year marks the 75th anniversary of the founding of the World Health Organization, In 1948, nations came together to recognize that health is not a luxury for the rich, but a human right for all, an end in itself. More than ever before, the world needs strong visionary leadership and global cooperation rooted in solidarity to realize that right. I thank you.